You're watching Baptist Health's Resource Live, where our respected experts bring you timely and practical health and wellness information to improve your family's way of life. We're healthcare that cares. This is Resource Live.
Hello, everyone. For new mothers, the thought of trying to breastfeed is overwhelming and sometimes daunting. Yes, folks, today we're talking boobs and what they're meant for, breastfeeding. Hi, everyone. I'm journalist Neki Mohan, coming to you live from the Baptist Health Newsroom. Breast milk provides the ideal nutrition for infants. It has a nearly perfect mix of vitamins, protein, and fat, everything your baby needs to grow. The benefits of breastfeeding are endless, and lactation specialists can help ensure mothers grasp the technique and navigate through the challenges, because there are challenges. August is National and World Breastfeeding Awareness Month, and we have with us today 3 experts from the Baptist Health family to talk about mommy-baby connection and what to know about breastfeeding. I'd like you to welcome them all. Anne-Marie Sawicki, Lactation Consultant at Baptist Health's Boca Raton Regional Hospital. Chay Shavrick, Women's Health and Perinatal Nurse Navigator at Baptist Health's Lynn Women's Health and Wellness Institute. And Taylor Walker, content creator and advocate and mommy extraordinaire. Thanks to all of you for being here. It is such a pleasure to have you with us today. Let's talk boobs. But before we dive into today's topic, I want to remind all our viewers out there, this is your seminar. Send us your questions. Send us your comments throughout the segment. We are here from you and happy to answer all the questions, any questions you may have. Starting with Anne-Marie. Anne-Marie, for many moms, trying to breastfeed, deciding to breastfeed involves a lot of factors. Let's talk about the benefits of breastfeeding.
Like you said, breast milk is the ideal food for human babies. It has the perfect mix of proteins, calories, and it changes specific for your baby. As your baby grows, the milk is going to mature and be ideally for your baby. It's going to help with to fight off viruses and bacteria, and it's going to help your baby grow. And in this particular time in the pandemic, it's really important that your baby get the best optimal nutrition as possible.
Yeah, I mean, it's so important. Chay, what can an expectant mother do to prepare for breastfeeding ahead of time before the birth of the baby? I know you were talking about this earlier. It's like, if after they had the baby, they're so overwhelmed, they may not receive the information as well as they would before they had it.
Yes. So basically, something that's close to my heart is having a breastfeeding plan, creating a plan the same way, people will spend months talking about a birthing plan and that's over in 10 seconds, but a breastfeeding plan, and again, we can plan and God can laugh. So it doesn't mean because you have a plan, but at least knowing, what some of the obstacles could be in the early days and making sure that you have the support. So I think we all talked about support for different reasons, but making sure that your partner or your spouse or somebody is on the same page as you, so that in the early days, a mom can get her footing, whether that be for a week or 2, and discuss the breastfeeding plan with your partner. I think it's really important to have a partner that supports you, because if they come from a cultural background where they're ashamed or not comfortable or they don't want the family to see it, you're not going to get that same nurturing, and again, I'm coming from 20 years ago where we were trendsetters and there wasn't a lot of support. So I think nowadays there is more support, but and remembering that, partners are not mind readers. So if you plan this out ahead of time, I talk about a little honey-do list. So the honey-do list, it's mainly for getting sleep, helping with the housework, and kind of navigating all of the phone communications, emails, things at the door, so that mom can just settle down. So I think as long as you have your support system and you create your plan, and another big one we know is just making sure that you've made a relationship with a lactation consultant Every insurance offers a couple of visits, so I would book those visits ahead of time. And just like if you're going to play tennis, you're going to get a tennis coach. You're going to breastfeed. You want to have a lactation consultant.
Wow. Tread lightly. You're getting on a lot of people's relationships now. Honey-do lists, support. Woo-hoo! You sure you're not talking about the pandemic? Taylor, you are a pro. You are an advocate for breastfeeding. I mean, one of the things is like, boobs, big or small, that's what they're here for, right? But to breastfeed properly, you need to eat. How many calories do you need to consume to support breastfeeding and other factors a lot of people don't think about?
Yeah, I think when we start breastfeeding a lot of the time, and I am a pre-postnatal corrective exercise specialist, so I see this with my postpartum clients. They hear that when you start to breastfeed, you should automatically lose weight, when it's almost the opposite. Your body needs to hold on to those calories to nourish and feed your baby. So you actually need an additional 500 calories during the postnatal breastfeeding period. Whereas when you are perinatally, they suggest anywhere from 300 calories. So you still need adequate amount of nutrition, healthy fats, whole grains. I know there's anecdotal evidence that things like oatmeal can really make your milk nice and vibrant and rich. So just really, postpartum breastfeeding time is not the time to focus on what we call the bounce back, right? You're stepping into a new role as mother, and you're essentially becoming a new kind of woman. So let go of really your thought process on wanting to lose weight during that time and focus on nourishing yourself so you can nourish your baby. And with that will come energy, and then the sleep will come and everything will fall into place.
But that's not what Instagram says. I mean, you always see the snap back, the bounce back, and people lose track that they're actually, you're supporting a life,
Absolutely.
Anne-Marie, some moms choose to breastfeed for a few days, a few weeks, a few months, some even for a few years. No judgments here. What is the suggested time frame a mother should plan to breastfeed for that has like the results we want for our children?
Everyone's idea of breastfeeding is different. Everybody's lifestyles are different. The recommendations from the World Health Organization is that exclusive breastfeeding feeds should be for the first 6 months. So whether the baby gets it directly from the breast or if mom pumps and gives it to the baby, ideally you want to just give the baby breast milk for the first 6 months, and then introduce foods as baby is developmentally ready for solid foods, and then continue to breastfeed for a year or longer, as long as it's mutually desired for mom and for baby. I tell all my patients that if mommy's not happy, the whole house isn't happy.
Amen.
So sometimes how the baby gets the breast milk doesn't really matter. And remember, any amount of breast milk that you give to the baby is a benefit. A little bit is better than none. More is better than some.
Yeah, no, that's great. And I love that you say introduce foods that they're developmentally ready.
Right.
I had a 10-pound baby that came out with teeth, so she was ready for it. So, rice and beans, she was like 2 months eating rice and beans. Chay, loved ones can feel so helpless at home. And I love that Anne-Marie just said, it doesn't matter who gives the baby the breast milk. Because, when mom is breastfeeding the baby, how can loved ones of a new mom support her and set her up for success when she's breastfeeding? For my friends that had to go back to work, even giving dad a bottle with some breast milk helped him feel like in the process.
So again, going back to planning breastfeeding plan with your significant other, your support system, some of these things will be worked out, but just remember that people are not mind readers, and partners and significant others, it's nice to have some of these roles discussed ahead of time. So I recommend in the early days, just making breastfeeding like a group activity, especially with COVID, socializing and everything is so limited. So supporting mom early on can be a beautiful experience for the entire family. You can create an environment, when you talk about a desert versus a rainforest, you want to create like a rainforest type of environment. So, lowering the lights and making sure there aren't any, annoying noises. Maybe you can put on some music. Scents are really good. I know when I was nursing, I loved the rose oil. So having, everything you would think of in a rainforest, sight, scent, smell, and sounds. And then having a tag team, you know, when baby's ready to eat, maybe the partner will put on a clean diaper while mom's getting herself situated. Again, in the early days, figuring out where her best position is. At the beginning, the first few days, sometimes it's nice for them to jump in for a hot shower and kind of just get those breasts filled and primed and ready to go. And so coming out of the shower and having that letdown be easier. And then as a family, just giving words of encouragement. You guys have already discussed this. So saying, I know you're not sure, or you're swollen, or this is uncomfortable, but you're doing so great. And be present. And, if you're in a situation like Taylor, where there's other kids in the house, let those kids be a part of this process. This is our quiet time. We can sing a song, we can read a book. You can have like a little set of baskets from the dollar store where, maybe there's something in that genre. Other things, again, if anybody is offering a gift, highly recommend a cleaning service. A cleaning service is worth the weight in gold, because a lot of that stress is keeping up with the house, keeping up with the laundry, the food. So it takes pressure off of everybody. And financially, I'm sure there's somewhere they could cut a corner on something, a less expensive stroller or whatever it is, to have that additional help. Like Taylor mentioned, nutrition. A lot of times new moms won't even have their first sip of water until 5 o'clock. So when mom's sitting down to nurse, have finger foods, because that's all she doesn't really have time to sit down for a plate. So you can have fruits, you can have little sandwiches, little rice cakes with peanut butter, and then always hydration, bringing in a nice glass of whatever they like to drink, a lemon water, something like that. So again, going back to that rainforest type of idea. And after mom is done nursing, that's a great time for, again, the support person to burp and maybe change a diaper and go for a walk and talk to the baby and be present, so that mom can do some self-care. Mom just went through, a traumatic time, and it's nice for her to have a moment to get in the shower and start her healing. And then lastly, just remembering to give mom some time to sleep and recover, because the sooner a mother gets her footing, the better the entire family is going to be. And then again, having that ongoing honey-do list for things that are going on around the house, so that her mind can be at ease. It could be anything like, Aunt so-and-so is dropping off a baked ziti or whatever it is. So remember, people are not mind readers, and that's why creating this early day plan gives mom the support she needs to be successful.
Where were you 14 years ago, Shay? Where were you 14 years
I'm
ago?
experiencing it all with no help from anybody. It's a journey that,
Oh my goodness.
it's good information.
Yeah,
Don't
no,
you
it's
feel
great
like, oh my
information.
goodness, to just such a short amount of time.
In my mother's era, my mother's one of 12, they just kicked the husband out, I think, until the kids were like 6 months old. I mean, I really think they never saw him,
But it was a women tribe, and the women they didn't take the baby away and then say, Mom, you go cook and clean and do laundry and food shop. They let them settle and create that bond and have a moment, and the women, and it was beautiful.
Yeah, no, it's so important.
Yeah.
Taylor, breast pumps can help ease breastfeeding by giving others the ability to feed the baby. What are the benefits of cordless pumps versus regular pumps? A lot of people have to pump because simply they got to go to work too.
Yeah, I think it's really a personal preference. Over the past few years, we've seen the onset of different pumps like Willow or the LV. And I do get a lot of questions online because we actually invested in an LV pump. I have a 3-year-old now. He's running around. He rules the roost. So for me, I don't have time to be attached to my pump. However, with that said, most insurance does cover a pump. So an additional cordless pump is it's an investment for the family. You have to look at a few things. Are you going to have the time? Maybe if you have one child, you will have more time to sit connected to the wall, and maybe the first baby isn't the time for the investment. Second of all, the cordless pumps, they give you so much more freedom. but you have to find the right fit for yourself. So people will use it once or twice and think, oh, this doesn't work for me. I'm only expelling an ounce or 2 ounces, which won't feed my baby. However, if you interchange in parts and find the right size for your anatomy, you can have much more success. So I think it's a personal option. For me, it's more of a convenience thing. And I think everyone's finances are different, but if you are thinking about investing in a cordless pump, it's the only way I can pump right now with a toddler and a 3-month-old. I'll be honest, I haven't touched my corded pump. But just make sure you keep the receipts. You look at the return policy. If it doesn't work for you after trying it a few times, the Medellas, there's so many pumps out there. I personally have a Medella. They work fantastic, but it's an additional effort to sit, plug, do.
Yeah. No, I had a girlfriend that would pump as she commuted. And I was like, what if you get pulled over?
Yeah.
Like, what is-
Yeah, I mean, we've done, like, I usually, what I do love about it, though, I have to say, is if she's nursing on one side for like 10 or 15 minutes, I'll pump the other, which is so nice because I just stick it in my nursing bra, she's there, and then it's a double whammy. So I have, a bottle for the evening if I want my husband or my caretaker, just to give me a break, especially in those early few months where you just feel like, everything is just so depleted and you just need a break. It's a great option for mom. If we go out for a family walk, I can put them in and I don't have to worry about it. We can be outside. I can be happy. I could be with CJ, and then life goes on.
Wow. Anne Marie, it sounds like Taylor had an amazing lactation consultant at one point. What should a new mother expect when it comes to breastfeeding after having her baby? And a lot of women feel inadequate because they think, oh, it should be normal. You should come out of my womb and you should be feeding right away, right? That's how it works?
Yes, yeah. Unfortunately, sometimes it does work that way. But initially, getting the education right away before you're even pregnant. It was great how Chay said, involving the other children. Just breastfeeding and having siblings around just puts in the mindset that breastfeeding is the human feeding norm. And there would be no other question in other parts of the world where breastfeeding is more readily available and nobody even thinks about formula feeding, but getting the education right away. If you have any medical problems that might prohibit you from breastfeeding, getting the accurate information and getting a plan to optimize your feeding practices from the get-go. How well you get off to the right start, the practices that are in the hospital that you're going to deliver really will affect how successful you are. So prenatal education, support in the hospital when you are right after delivery, all the nurses, not just a lactation consultant, but everybody on the same page, supporting you, getting off to the right start. If you're separated from your baby, what you might have to do to start pumping and getting your milk going as soon after delivery is really going to affect how soon your milk comes in, how plentiful it is when it does come in, and how long it lasts. And educating the whole family. I had parents and family members who did not breastfeed. So they felt helpless and they didn't know what to do. I welcome all parents, all grandparents, anybody who's there going to support you in the early days of breastfeeding to hear the education. So at 2 in the morning, when I'm not there, they're able to help you. And then they know where to get help when they know things aren't going so well.
Like I said before, I couldn't breastfeed. So my daughter had so many digestive issues early on, the reflux, and at that point, it's just, I didn't have you and Chay and Taylor at my house, which I needed. I'm getting a little resentful.
No, don't beat yourself up. We have to empower women, and we are doing the best job that we can. And you can do everything, but sometimes you can't do everything all at once. So if you just try your best, and that's all you can expect.
I used to wake up every day and say, "She's alive. I'm doing great."
Yes, you're
doing great. I'm winning. Chay, why is breastfeeding easier for some mothers and really hard to accomplish for others like me? Is breastfeeding innate, or is it more of a skill that takes practice? What do you tell new moms? Because it can feel like, oh my goodness, something's wrong with me.
So I make 200 postpartum calls a month which like over 2,000 mothers I talk to in a year. And I have to be honest, only 1 or 2 have said it came natural. And the reason is because breastfeeding is a skill. It's not like in wildlife, something you're born with. So if you look at wildlife and you throw a bear or a tiger or a dog or a cat in a moving, let's just say, stream, those animals know how to swim to the sides and get out. Human beings, that's how we have drownings. We don't have that instinct. So breastfeeding is a skill, and it's something like swimming that you actually need to learn. And that's why, again, engaging and enrolling in support. And yes, you could have the support of a mother or sister, but I love the lactation consultant. Sometimes it's almost like a mental health provider. When they're outside of the family, they don't have like all of those biases. And so you're actually, and I like to use the example, I'm not a very good dancer. And so like somebody else who is challenged with breastfeeding, if I wanted to salsa, I would need to enroll an instructor. I would have to have a support system. So I'd have to have my partner. I'd have to probably salsa every week for 3 months. And then I would have the confidence and I would be a salsa dancer. And it's very much the same with breastfeeding. As Anne-Marie was saying, there's all these little, I'm going to call it chitchy things, but in terms of the breasts, there could be issues with the nipple, you know, the hold, the way they latch, with the baby's mouth. There could be a tongue tie. And there honestly can be just a mother's fear that during those first 2 weeks when the colostrum is the main source of nutrition, that mom is just petrified that baby is not getting enough milk. And the truth is that colostrum is like a super nutrient, and they don't need ounces and ounces and ounces like they do later on. So all of that comes to education. And again, with dancing, it's a good instructor, a support person, whether it be your partner, your friends, practice. And then once you get your footing, I believe you're good to go. Now, when somebody says I couldn't breastfeed, I would never want to make anybody feel bad. It's, you know, I think it's important to just be where you're at. But if it's something that you really want, like if I really want to salsa dance, I really need to take lessons.
Listen, I'm looking forward to seeing those videos on Instagram, Shay. I mean, you do your little 1, 2, 1, 2. Taylor, mastitis, unfortunately, is a reality. It's a very painful infection that many women get while breastfeeding. What can mothers know about how to avoid it and when they should go to the doctor about it?
So the biggest thing is really, I think it's hard to avoid, and you guys can let me know if that's the case or what you see in your lactation practice. However, I think keeping the dialogue open with your OB and postpartum or your lactation consultant is very important, because you'll notice with it, you'll maybe experience chills, fatigue, almost like a flu-like feeling, breast tenderness, sometimes discharge, and those things can be alarming. But you can also be experience just a clogged duct that might take a little time to massage out, or you can use your pump. So really, if you feel the onset of symptoms, I know first time around, I had to call my OB a couple of times, talk to them, have an open dialogue about what your symptoms are, what you're feeling, and they'll be able to give you the proper advice of what you should do. It's hard to go down that Google rabbit hole, but it is a very painful, uncomfortable thing that many women experience. No, pictures are not good.
Pictures are not good.
No Google.
Very painful.
Our viewers' questions are coming in now, and of course, top of the list. And we heard the CDC come out with new guidance regarding pregnant mothers and vaccinations, especially when we're talking COVID-19. What is the advice from the experts, guys?
The recommendations are that women should get vaccinated. It is a respiratory droplet infection, and still you should be able to provide your baby with skin-to-skin contact and still breastfeed your baby, whether you're COVID positive or experience symptoms or not. And the risk of not breastfeeding is more, but you do the standard precautions of washing your hands, putting on a mask, But that breast milk is so important for your baby to provide antibodies to prevent your baby from infection and any kind of infection. We're coming into flu season now, and those are really important. The benefits of breastfeeding are so important. So continue to breastfeed as much as possible exclusively.
Yeah. And it's also about weighing the risk. I mean, if you're someone that's coming in contact with a lot of people, sending older kids to school, but if you're home alone with your kids, with no one leaving the house, different reality, right? Another question, how long is frozen breast milk good for? I mean, I had a friend, she was really tiny. She pumped so much milk. She was like sending it all over the world, I felt.
Right.
Extra.
Yeah. Breast milk, it has antibodies that help fight bacteria. So breast milk is good for, depending on how cold the room is, anywhere from 4 to 10 hours at room temperature. In the refrigerator, you want to store it inside the refrigerator, not on a door, so that the temperature is not being changed all the time. But in a refrigerator, up to 5 days, and in a refrigerator freezer, like 3 to 6 months, and in a deep freezer, up to a year. I would never get rid of breast milk. You can bathe your baby in it, feed it to the plants.
Can it work on your skin? Can you do a facial? How about a breast milk facial? Listen, we could be rich doing that. You got some extra milk, Taylor? Come on.
I do.
Yes, hook us up. Okay, question for a viewer I definitely want us to get to. My baby was born 2 weeks ago, feeding well. I am nursing and pumping. She's above birth weight following her 2-week appointment, but has a moderate tongue tie. Is it recommended to fix to help with better latching and long-term breastfeeding? I don't even know what that is. Explain. I see Shay nodding her head. You sound like you know what that is.
Yes. We see a lot of tongue ties lately, and I think it's coming more to the forefront because women are not taking no for an answer. Why can't I breastfeed? If it's you only fix a tongue tie if it's troublesome, if it's painful that you don't want to breastfeed, if the milk supply is not coming in sufficiently enough, and if the baby's not gaining enough weight, her baby's back to the birth weight, if she's not experiencing pain, what I would suggest is though she keeps an eye on her breast milk. Oftentimes I see babies who have a tongue tie, mom has a plentiful milk supply in the beginning and it runs really, really fast with a little bit of effort from baby. But after a while, the milk supply might go down anywhere from 1 to 3 months. And all of a sudden she feels like the milk is not there anymore. And you wonder why. And it was as a result of the tongue tie. So you keep an eye on it. If there's no problem, you just monitor it closely. We have support groups here. Right now there's Zoom because of COVID. And moms come in. I have anywhere from 4 to 10 moms sometimes come in and they just check in to make sure everything's going okay. They ask questions. And these are the type of questions that I get all the time.
Yeah, no, absolutely. Final thoughts, guys, as we wrap up for today. All great information, and virtual has been a blessing because I know a mom at home can sit in and tune in, or Taylor while she's walking around with the cordless breast pump, or and the 3-year-old and the newborn, and then you're doing squats. Taylor, what are your final thoughts for today?
I just want to tell any mama out there is go easy on yourself, that you're doing the best you can and you're doing an amazing job, and just try to remember that every single day.
Awesome.
And I want to second that. That really is all any mother needs to hear is that you got this, you've got the intuition, you know what you're doing. Pause and listen, and you'll be okay.
Yeah. And Marie?
Yeah, childhood only happens once. Enjoy it now. A great leader once told me this. And don't beat yourself up on it. It all will work out. And if you need help, don't be afraid to get support.
Awesome. Well, you guys have been a delight. I felt like we should have at least had a glass of wine in this conversation, or a glass of, maybe there's breast milk cocktails now, who knows, but or mocktails. Thank you so much. It's been a great conversation. Thank you all for sharing your insight with our audience. Remember, viewers, you can always connect with us on our social media channels, Facebook, Instagram, Twitter, and LinkedIn. Check out our resource blog for the latest news at baptisthealth.net/news. You'll find a link there to all episodes of the Baptist Health Talk podcast as well. On behalf of everyone here at Baptist Health, we ask you to please stay safe and say yes to the COVID-19 vaccine.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Resource Live is brought to you by Baptist Health South Florida, healthcare that cares.